In another video in the Problems With series, we're going to discuss Botox. So if you've been to the channel before, then welcome back. If you're new to the channel, then welcome. In another video in the Problems With series, we're going to discuss Botox. Now, Botox is a brilliant medication that's been used hundreds of millions of times around the world. But it's important for the consumer to understand that it's not the answer to all of their problems. And in fact, I have seen Botox applications where there is a significantly odd or strange look. And I'm going to discuss some of the reasons why this can be the case and how to avoid it wherever possible. Botox was discovered in the 1970s as a therapeutic drug, and it was refined in the 1990s in order to be used for cosmetic purposes. And since then, it has become a huge boom for the aesthetic industry. Its use is extremely common, especially in my practice, and it's become the go-to treatment for people just trying to experience aesthetic treatment for the first time. When done properly, it's an extremely effective way to look fresher. It works by paralyzing muscle, and so by doing so, it can create the impression of youth by softening lines and wrinkles and improving slightly tired skin. Certainly, it sounds like Botox is the perfect treatment, but unfortunately that's not the case, and in this video we're going to go through some reasons why. Because Botox relaxes muscle, then in large doses it leads to muscle paralysis. Some people would argue that this is the point. Now, this paralysis lasts for typically 3 to 6 months, depending on the patient and depending on the muscle. And although the effect of Botox is permanent to a given muscle unit, eventually the body regrows a new muscle unit and the muscle in question comes back to life. The difficulty with paralysis is that what we're trying to achieve is a youthful look. If you think about the youthful patient, someone in their teens or their 20s, then they have movement, they have lines and wrinkles even, but they don't have multiple fine lines and wrinkles on the background of poor quality skin. So common sense would suggest that the result that we're going for is a look reminiscent of someone in their teens or their 20s. Unfortunately, this is very often not what we see. I have patients who've had Botox who've had some, and they have a little bit of movement remaining, and so they come back for a top-up thinking, well, if some Botox is good, more Botox must be better. The difficulty is this leads to a whole army of people who have no movement in the classic 3 areas: the forehead, the crow's feet, or the glabella, the scowl area, and this is a complete giveaway that you've had Botox. It has created a whole population of patients between the ages of 20 and 50 who all, broadly speaking, look the same. They all have the same frozen features, and this is a problem. I think this is something that should definitely be avoided. We always say in my business that good plastic surgery walks past you in the street. You don't see it, you don't recognize it, and unfortunately we all now know the classic giveaway signs of too much Botox. An add-on to this problem is that Botox also encourages the skin to produce additional skin oil. The skin oil can create a very shiny appearance, and this, on the background of an almost motionless face, can create the classic Botox look, which we've seen. And again, for me, this is not the look that I think we should be going for. This is definitely something that should be avoided. Botox application, furthermore, can add to our facial aging problems. As we mentioned, it paralyzes muscle, which, if you paralyze muscle which has no function, can be a beneficial thing. The difficulty is that the facial muscles all have significant function. The first one I want to talk about is the forehead. The forehead muscles give us wrinkles, but they also help elevate our eyebrows. Now, this elevation of eyebrows in patients with heavy eyebrows, or indeed heavy upper eyelids, can make the eyebrows look flatter and the eyelid skin look heavier. Flatter eyebrows make us look surly and serious, and heavy upper eyelids make us look sleepy or tired, or actually can make us look older. And so too much Botox to the forehead of patients with low-lying brows, or Botox where upper eyelid heaviness is a problem, can actually result in a trade-off between a youthful, wrinkle-free forehead but tired, heavy eyes. And so this is something that should be considered, and in my experience, anyone with heavy lids or brows should think twice about having anything other than the smallest dose of forehead Botox. The second thing that all these muscles do, which is important, is they take a significant role in facial facial expression. When we smile and when we talk and when we laugh, our face is designed to move, and actually our non-verbal communication, both to other humans and to, say, our pets, is very important. And so if we take this key facial expression away, then actually this limits our ability to make our message understood. Evidence shows that it can make us look less trustworthy, and it can also mean that our communication is more ineffective. I think this is a downside to Botox, and therefore I always advise that movement with no wrinkles is the ideal goal. I think no movement is very much a poor outcome from Botox application. Another well-known complication of Botox, which is thankfully quite rare, is eyelid ptosis, where the Botox itself trickles down onto the tiny muscle that elevates the upper eyelid and can paralyze it for weeks or even months. This makes us look noticeably asymmetric and is something that has to be addressed either with waiting a significant amount of time, or there are some eye drops which can help, but this is when Botox definitely doesn't make us look fresher or more youthful. If you have problems with heavy brows or heavy eyelids, then it's suggested that Botox can easily lift your eyebrow. This is not my experience, and I've tried every different way to do so, but in most cases Botox can only have a very limited role in raising the eyebrow, and so is not something that can easily be adopted if you're experiencing some of these problems. Botox is difficult to apply on patients with very heavy skin, very thick oily skin, and also in patients with very fine skin. Patients in their 50s and even 60s tended to spend too much time in the sun, and all of these have led to significant sun damage. Sun damage means the skin is finer and more papery. The difficulty with applying Botox to people with very fine skin is that either the wrinkles are completely removed and the face looks wrinkled in some areas and not wrinkled in others. The other problem is that the Botox can be relatively ineffective when even tiny movement creates multiple fine lines. In my experience, Botox for these patients is better if slightly underdone, and Botox is applied regularly for 2 to 3 years. Only after this amount of time can the wrinkles start to fall out and the face looks fresher. But in these patients, Botox is a long-term fix, definitely not a short-term fix in many cases. Patients with particularly heavy skin tend to have quite deep set lines, and again for these patients it takes 1 or 2 years for the deep wrinkles, especially in the scowl area and the forehead in men, to start to drop out and to notice a really long-term effect. Botox unfortunately wears off after 3, 4 or 5 months depending on who you use and what product you use. This is good for business because it means that Botox applications happen 2 or 3 times a year, but unfortunately it takes what is a very effective, cost-effective treatment into the realms of moderately expensive, and so don't be surprised that I suspect this is designed into the way the medication works. Understanding the biology of Botox leads me to believe that this is an inevitable consequence, but certainly it means that Botox is something that you need to stick with. I see a small number of patients, maybe 2 to 3% of the total population, who become resistant to Botox. Now, this is probably an immune response, and unfortunately, even though there are 5 different brands of Botox, I've found patients who are immune to one tend to be immune to all of them. This means that Botox is no longer a therapeutic option for them. It means that they're stuck with their lines and wrinkles because we don't really have a more effective way to treat these, and these patients are often very disappointed and saddened by the fact that Botox is no longer effective in their particular circumstance. Having said all of this, Botox is a very effective way to make us look fresher. The important caveats are that too much Botox is definitely not a good look. It's not something a patient should go for, and usually more Botox is not better than some Botox. It is very well studied. There have been so many applications over the years that the vast majority of safety concerns have been ironed out, and so it should certainly remain part of all estheticians and plastic surgery's weapon of choice. But I think it's important to know what it can't do. Botox is only effective at treating, in my opinion, the 3 main areas of wrinkles, namely the forehead, the scowl, and the crow's feet. Things that it will not fix are lines around the mouth, and if you try Botox to treat these lines, then you can end up with mouth asymmetry or even dribbling and drooling. Botox cannot help the jawline. Botox cannot help the falling cheek or the jowl. Botox cannot help the aging eyelid, as we've mentioned. Botox cannot cannot really help the sagging neck. Some people inject it into platysmal bands, the fine bands that you see in ladies' necks often after a facelift. Botox can help the individual bands, but it cannot help a sagging neck. So if anybody recommends that you have Botox in your jowl or your neck or your cheeks, then this is simply a matter of them trying to sell more Botox rather than Botox being the answer for any of these particular problems. It should form part of your toolbox, but Botox certainly is only one small part with a much more limited scope of effectiveness than often it's sold. I hope you enjoyed this video. If you did, then please like and subscribe. By all means, go to our channel and have a look at some of the other videos about plastic surgery, do's and don'ts, and the advantages and disadvantages of each technique. Hopefully we'll see you on the next one, and thanks very much for joining us on this one.